You've probably been told that if a doctor prescribed it, it must be safe. I believed that too for a long time, until I started seeing the same pattern in my examination room, over and over again. Patients in their 60s and 70s, brought in by worried families who said the same thing. He was fine last year. Now he repeats the same question 4 times in 1 hour. Women who could balance a checkbook their whole lives suddenly couldn't remember how to turn on the microwave. And every time, when I looked at their medication lists, the same kinds of drugs appeared. My name is Dr. Raymond Cole. I'm a clinical neurologist. For more than 20 years, I've treated seniors for memory loss, and I've discovered that a shocking number of them don't have Alzheimer's or dementia. They have drug-induced brain fog, and the worst part? Their doctors never warned them. Today, I'm going to reveal 9 popular medications that trigger rapid memory loss after 60. This isn't about making you afraid of your medicine cabinet. It's about giving you the knowledge your doctor may not have time to share, because when it comes to your brain, what you don't know can hurt. Here's something most people don't understand. When a new drug is tested for approval, the clinical trials are almost always done on healthy younger adults, people in their 30s and 40s, with one medical condition, taking no other pills, and with livers and kidneys that work like new. But by the time you reach 60, your body is completely different. Your blood-brain barrier, the protective filter around your brain, gets thinner and more permeable. Your kidneys don't flush out medications as fast. Your liver processes drugs at half the speed it used to. That means a standard dose that was fine for you at 45 can become a toxic overdose at 65, simply because the drug stays in your system longer and builds up 2 dangerous levels. And when that happens in your brain, the first symptom isn't a rash or a stomachache. It's memory loss, confusion, hallucinations, symptoms that look exactly like early dementia. I've had patients come to me in tears, convinced they were losing their minds, when the real problem was sitting in their weekly pill organizer. So before we name names, let me give you 4 things to hold on to. 1. Never stop any medication suddenly without a doctor's guidance. Some withdrawals can cause seizures or strokes. 2. Not everyone will have memory loss from these drugs, but the risk rises dramatically after 63. The danger is often in combinations. 1 mild offender might be fine, but 3 together can be devastating. And 4, the good news is that drug-induced memory loss is often reversible. When you remove the right pill, the brain can heal. Now let's meet the 9 culprits. The first medication on our list is hiding in plain sight in almost every home. First-generation antihistamines, specifically diphenhydramine, which you know as Benadryl, Nytol, Zizquil, and every nighttime PM pain reliever. These drugs are powerful anticholinergics, meaning they block a brain chemical called acetylcholine. Acetylcholine is the save button for your memory. Without it, your brain cannot form new memories. In a young person, that blockage causes drowsiness. In a person over 60, it causes confusion, disorientation, and even hallucinations. A long-term study published in JAMA Internal Medicine followed nearly 3,500 seniors for 7 years. Those who took these drugs for just 3 years had a 54% higher risk of developing dementia compared to those who never took them. And because these pills are sold over the counter, people assume they're harmless. They take them every night for sleep, not realizing they're slowly erasing their ability to remember the next day. The safer alternative? Newer antihistamines like loratadine, fexofenadine, or cetirizine. These newer versions do not cross into the brain. Same allergy relief, zero memory fog. The second and third drugs on our list break my heart because they treat a genuinely distressing problem over active bladder. Millions of seniors take oxybutynin ditropin or tolterodine. Detrol to stop embarrassing leaks and frequent bathroom trips, but these are among the most potent anticholinergic drugs ever made. A study from the University of Michigan gave healthy older adults oxybutynin and then tested their cognitive function. Their scores dropped to the level of patients with mild Alzheimer's disease. Even more shocking, some of these patients had been misdiagnosed with dementia and referred to memory clinics when all they needed was to stop the bladder pill. After stopping the medication, their memory improved significantly within 3 months. The brain had been drugged, not diseased. If you or a loved one takes an overactive bladder medication, ask your doctor about mirabegron Myrbetriq. It works through a completely different mechanism, beta-3 receptors, and does not enter the brain. It controls the bladder just as well without stealing your memories. The fourth drug is an older class of antidepressants called tricyclic amitriptyline, nortriptyline, and doxepin. I want to be very careful here because depression in seniors is real and treatment saves lives, but tricyclic antidepressants are rated as potentially inappropriate for anyone over 65 by the American Geriatrics Society Beer's criteria. That's the official list of drugs seniors should avoid. Why? Because they are extremely anticholinergic. Patients on these drugs often lose what we call executive function, the ability to plan, organize, and multitask. They can't follow a recipe, manage their finances, or remember a phone number long enough to dial it. And because these drugs have been around since the 1950s, many doctors still prescribe them out of habit, especially for nerve pain or migraines. The safer alternatives include modern SRIs like sertraline's Aloft or escitalopram Lexapro, which have much milder effects on memory. For nerve pain, gabapentin or duloxetine Cymbalta are better choices, but never stop a tricyclic antidepressant. Suddenly the withdrawal can be severe. Talk to your doctor about a slow transition. Now we arrive at the most dangerous category for senior brains, benzodiazepines. These includes Enax, Valium, Ativan, and Klonopin. They are prescribed for anxiety and insomnia, and they are extremely effective, which is why doctors write so many prescriptions. But here's what the drug commercials don't tell you. Benzodiazepines work by slowing down your central nervous system, and in the process, they prevent your brain from moving short-term memories into long-term storage. That means you can have a full conversation with your daughter at PM, and by AM the next morning you have no memory of it. This is called anterograde amnesia. It's listed in the package insert, but most patients never read that far. The long-term research is even more frightening. A 20-year study conducted in France and Canada followed thousands of seniors and found that taking a benzodiazepine for just 3 months increased the risk of developing Alzheimer's disease by 51%. Taking them for 6 months more than doubled the risk, and withdrawal from these drugs is dangerous. Seizures, stroke, and severe rebound anxiety can happen if you stop suddenly. If you or a loved one has been on a benzodiazepine for more than a few weeks, do not quit cold turkey. But do make an appointment with your doctor to discuss a slow, medically supervised taper plan. Safer alternatives for anxiety include buspirone or therapy. For sleep, we'll cover safer options in a moment. The 7th drug on our list is muscle relaxants, specifically cyclobenzaprine flexerol, carisoprodol soma, and methocarbamol robaxin. These are prescribed for back pain, neck spasms, and fibromyalgia. But cyclobenzaprine has a chemical structure almost identical to a tricyclic antidepressant. It is a massive anticholinergic. I have personally seen patients rush to the emergency room because their family thought they had a stroke. The patient was hallucinating, combative, and didn't recognize their own spouse. The CT scan showed no stroke. The toxicology screen came back positive for a muscle relaxant. After 48 hours off the drug, the patient was completely back to normal. But the damage isn't always temporary. Repeated use of these drugs causes permanent cognitive decline. Muscle relaxants should never be used for more than 5 days in a senior, and ideally not at all. The safer alternatives include physical therapy, topical lidocaine, acetaminophen Tylenol, and Hetor. Cold therapy. Some seniors benefit from low-dose gabapentin for chronic pain, but even that needs careful monitoring. The 8th drug is the so-called Z-drug sleeping pills Ambien Zolpidem, Lunesta Acipaclone, and Sonata Zaloplan. These are marketed as safer than benzodiazepines, but they act on the exact same brain receptors. The side effect profile is almost identical, including the terrifying symptom of anterograde amnesia. People take Ambien, then perform complex activities, cooking, driving, even having conversations with absolutely no memory of it the next morning. In seniors, the half-life of these drugs doubles because the liver processes them more slowly. A dose that wears off in 6 hours for a 40-year-old lasts 12 to 15 hours for a 70-year-old. That's why seniors wake up groggy, slow, and confused, and that confusion is often mistaken for early dementia. The American Geriatrics Society strongly recommends against using Z drugs in anyone over 65. So what should you do for insomnia? First, try sleep hygiene: a consistent bedtime, no screens for an hour before sleep, a cool dark room, and no caffeine after noon. If you still need a medication, ask your doctor about low-dose Razidone 25 to 50 milligrams or extended-release melatonin 0.5 to 1 milligram. A smaller dose actually works better for seniors. These options do not block memory formation. The 9th and final drug on our list is the darkest antipsychotics like quetiapine Seroquel, risperidone Risperdal, and olanzapine Zyprexa. These medications are approved for schizophrenia and bipolar disorder, but in many nursing homes and even in outpatient clinics, they are prescribed off-label to sedate seniors with dementia, who become restless, anxious, or aggressive. This practice is so dangerous that the FDA issued a black box warning, the strongest possible warning, stating that elderly patients with dementia who take antipsychotics have a significantly higher risk of death, primarily from heart problems and infections. Beyond the risk of death, these drugs accelerate cognitive decline by up to 70% and actually shrink brain tissue over time. If you have a loved one in a long-term care facility who has suddenly become zombie-like, confused, or unable to recognize you, check their medication administration record for antipsychotics. Ask the doctor, is this drug absolutely necessary? Can we try non-drug approaches like music therapy, light exercise, or treating an underlying urinary tract infection first? Antipsychotics have legitimate uses for severe mental illness, but they are wildly overprescribed in seniors, and the price is paid in lost memories and shortened lives. Now here's where everything comes together, and this is the most important part of the entire video. Most seniors don't take just one of these drugs, they take 2, 3, or 4. This is called polypharmacy, and it's the silent epidemic in elderly healthcare. The average American over 65 takes 4 to 5 prescription medications daily, plus over-the-counter pills and supplements. Each drug may have been prescribed by a different doctor, a cardiologist, a urologist, a psychiatrist, and none of those doctors talk to each other, so the anticholinergic effects add up. One drug might cause mild forgetfulness. 2 drugs can cause noticeable confusion. 3 drugs can cause full-blown delirium that looks exactly like Alzheimer's, and nobody connects the dots. I have seen this dozens of times, a patient labeled with rapidly progressive dementia who was actually taking 3 anticholinergic medications, and after we slowly removed them, their cognitive function returned to baseline within months. That's why I'm so passionate about this topic. These memory problems are not always inevitable. They are often reversible. So here is your 4-step action plan, and I want you to do this today. Step 1. Make a complete medication list. Write down every prescription, every over-the-counter pill, every vitamin, and every herbal supplement. Include the dose and how long you've been taking it. This single sheet of paper might be the most important health document you own. Step 2. Take that list to your pharmacist and ask them to calculate your anticholinergic burden score. Many pharmacies will do this for free. If your score is 3 or higher, you are in the danger zone for memory loss. Step 3. Schedule a deprescribing visit with your primary care doctor. Say these exact words. I am concerned about memory loss. Can we review whether all my current medications are still the right choice for my age and my brain? A good doctor will welcome that conversation. Step 4. Never stop any medication on your own, but start asking questions. You are the leader of your own health team, and you have the right to understand the risks. If this video gave you one thing, let it be this. You are not powerless. Your brain's health is not just about age or genetics, it's about the pills you swallow every day. Share this video with a parent, a spouse, or a friend over 60, someone who has a full pill organizer and has never once questioned what's inside it. That one share might be the most important thing you do today, and if you want to keep protecting your memory, hit subscribe. To Senior Health Hub. Next week, we're revealing the 5 supplements that actually reverse memory loss and the 3 that make it worse. I'm Dr. Raymond Cole. Don't let your medicine steal your story. Stay sharp, and I'll see you in the next video. Everything in this video is for educational purposes only and does not constitute personal medical advice. Always consult your own physician or pharmacist before making any changes to your medications. Your medical history is unique, and only your healthcare provider can determine what is safe for you.